Nearly 1 in 2 Canadians will be diagnosed with cancer at some point in their lifetime, and almost 1 in 4 of those diagnosed will end up dying from the disease. This discouraging prognosis can be attributed to the fact that there are several external factors known to alter the effectiveness of cancer treatments, and hypoxia is one of these factors. But what is hypoxia? Hypoxia occurs when inadequate amounts of oxygen are available at the tissue level. This results in the organism's inability to maintain homeostasis, which is the physiological process of maintaining balance and stability within cells, tissues, and organs. In a hypoxic state, there isn't enough oxygen being delivered to the important tissues to help them carry out essential functions for survival. This is perhaps due to low blood supply or low oxygen content in the blood.
The severity of hypoxia varies from case to case and can be acute, chronic, or both. As a result, there are a variety of long-lasting effects, since certain tissues can be exposed to hypoxic conditions for prolonged amounts of time without extreme consequences, while others can be severely damaged by this lack of oxygen. A common feature in most cancerous tumors are low oxygen levels, which we just learned is the basis of hypoxia. The hypoxic state can make tumors difficult to treat as it alters their cellular metabolism and can disrupt programmed cell death, resulting in uncontrolled cell growth and spreading of these tumors. The increased growth or proliferation of the cancer cells also contribute to the hypoxic conditions as there are greater demands for oxygen. Persistent hypoxic conditions stimulate the growth of vasculature, or blood vessels, which would seem to help increase oxygen levels. However, the growth of these blood vessels is very disorganized and prevents oxygen from reaching the cancer cells, resulting in chronic hypoxia.
Low oxygen levels promote the survival of cancer cells in two ways: by increasing the levels of a type of protein complex called hypoxia-inducible factors, or HIF, and by lowering the pH. We'll talk more about pH a little later. HIFs are highly involved in the cellular mechanisms that are triggered by hypoxia. Hypoxia results in the creation of oxygen gradients, places of high and low concentrations of oxygen. These gradients' presence increases levels of the oxygen-regulated HIF-1 alpha. HIF-1 alpha then goes to the nucleus of the cell and binds to HIF-1 beta, forming a dimer. This dimer triggers increased expression of target genes, which result in effects such as drug efflux, the pumping of the drug out of the cell, inhibition of the apoptosis or cell death, and promotion of autophagy or self-digestion of cell components. These all lead to cancer cell proliferation.
Hypoxia can also make cancer cells more resistant to chemotherapy. One reason for this is that the disorganized vasculature created by the hypoxic tumor cells results in poor delivery of the cancer drugs to the tumor cells. This creates a problem as drugs are generally absorbed into our bloodstream. Another problem faced by pharmaceutical companies is that their drugs are often unable to pass through the lipid membranes of these tumors. Hypoxia lowers the pH level of surrounding tissue due to the production of lactic acid from anaerobic glycolysis. This results in the normally uncharged chemotherapy drugs being too polar to pass through those hydrophobic membranes. One solution to this problem is to develop drugs that are only toxic when presented with a hypoxic environment. This would allow for higher doses to be used as they wouldn't affect the normal cells and tissues due to their lack of hypoxia-inducing conditions. Another solution is to use drugs that have neutral charges even at low pH levels, allowing them to pass through these membranes more easily.
Hypoxia may impose more difficulties in treating certain cancers, but it can also open up new avenues in treating them. Often, chronic tumor hypoxia can lead to necrosis, which is the death of cells in tissue or an organ as a result of compromised blood supply. Necrosis is a type of programmed cell death similar to apoptosis. It leads to an increased production in tumor-releasing factor, specifically TRF-alpha. Necrosis results in the rupture of cell membranes and the release of their contents. These necrotic regions of the tumors can then be exploited for treatment purposes. One approach includes administering a non-pathogenic strain of bacteria that grow in low oxygen environments. The spores of the bacteria grow in these necrotic regions and lead to the rupture and death of surrounding cells. To summarize, hypoxia is a condition that can affect a variety of individuals for a number of reasons. Hypoxia is a state in which cells and tissues experience a lack of oxygen as a result of low oxygen content in the blood, or low blood supply in general. For cancer patients, tumor hypoxia has its pros and cons. The hypoxic state of their cancer cells makes them more resistant to certain therapies. However, it also opens new research avenues in which hypoxia is targeted, potentially improving prognosis.
Created using Powtoon.